Certified Clinical Hemodialysis Technician Exam 2025-25 Practice Questions. Question 1. Symptom of disequilibrium syndrome include headache and nausea, extreme hunger, joint pain, hearing loss. Caused by rapid changes in blood chemistry. Question 2. What should the CCHT check before starting treatment? Vital signs, machine conductivity, access patency. All of the above. Safety checks are essential. Question 3. Which electrolyte is most dangerous if levels are too high in renal patients? Sodium, calcium, potassium, chloride. Hyperkalemia can cause fatal heart arrhythmias. Question 4. The primary goal of dialysis is cure kidney disease, remove waste and excess fluid, replace hormones, lower blood pressure. Dialysis clears toxins and fluid the kidneys can't manage. Question 5. Dry weight is defined as weight before dialysis, weight with no edema or extra fluid, weight after a meal, weight of the dialyzer. Dry weight is the ideal weight without fluid overload. Question 6. What is the role of erythropoietin, EPO? Control blood pressure, stimulate red blood cell production, digest protein, strengthen bones. The kidneys normally produce EPO, dialysis patients often need synthetic versions. Question 7. What does KT/V measure? Blood pressure, dialysis adequacy, heart rate, weight loss. It measures how much urea was cleared during treatment. Question 8. What is air embolism? Air in the lungs, air entering the bloodstream, low oxygen, high blood pressure. It is a life-threatening complication where air is pumped into the patient. Question 9. A frill or bruit indicates a clotted access, a patent, working, fistula, high blood pressure, infection. Vibration, thrill, and sound, bruit, show blood flow. Question 10. Hypotension during dialysis is often caused by fast fluid removal, high blood sugar, caffeine, salt intake. Removing fluid too quickly can drop blood pressure. Question 11. A possible complication of a fistula is aneurysm, Steele syndrome, thrombosis. All of the above. These are common issues with vascular access. Question 12. Dialysate is composed of purified water and chemicals, whole blood, saline only, glucose only. Dialysate bath uses treated water and acid/bicarb concentrates. Question 13. The bicarbonate in dialysate helps to prevent clotting, correct acidosis, remove potassium, thin the blood. Bicarb acts as a buffer for the blood. Question 14. The venous needle returns blood to the machine, the patient, the drain, the filter. Venous is the return line to the patient. Question 15. Which access type is considered the gold standard? Catheter, AV graft, AV fistula, port. Fistulas have lower infection rates and last longer. Question 16. The dialyzer clearance refers to the size of the filter, the rate of solute removal, the price of the treatment, the amount of water removed. Clearance measures how effectively toxins are removed. Question 17. First-use syndrome occurs when the patient is new. A new dialyzer causes a reaction. The access is first used. The water is dirty. Sensitivity to new dialyzer membranes/materials. Question 18. The movement of solutes from high to low concentration is osmosis, diffusion, ultrafiltration, convection. Diffusion is the primary mechanism for clearing toxins. Question 19. Heparin is used in dialysis to treat pain, prevent blood clotting in the circuit, lower sugar, increase blood flow. Heparin is an anticoagulant. Question 20. Osmosis is the movement of solutes, blood, solvent, water, toxins. Osmosis moves water across a semi-permeable membrane.